Several glucagon-like peptide-1 receptor agonists that are structurally similar to human GLP-1 can lower the risk of cardiovascular events in patients with type 2 diabetes. Efpeglenatide is an investigational GLP-1 receptor agonist that is based on the exendin-4 molecule. Its effects on cardiovascular and renal outcomes in patients with type 2 diabetes who are at high risk for cardiovascular events are unclear. In this international Phase 3 trial, 4,076 adults with type 2 diabetes and either a history of cardiovascular disease or current kidney disease plus at least one additional cardiovascular risk factor were randomized to receive weekly subcutaneous injections of either 4 milligrams or 6 milligrams of efpeglenatide or placebo. Participants also continued their current diabetes regimens. The primary outcome was the first major adverse cardiovascular event, a composite of non-fatal myocardial infarction, non-fatal stroke, or death due to cardiovascular or undetermined causes. During a median follow-up of 1.8 years, this outcome occurred less often in those assigned to efpeglenatide. A key secondary outcome was a composite renal endpoint comprising microalbuminuria or decreased kidney function. Again, this outcome favored efpeglenatide. Severe adverse gastrointestinal events, including constipation, diarrhea, nausea, vomiting, or bloating, occurred more often in the efpeglenatide group. Other adverse events did not differ between the efpeglenatide and placebo groups. The authors concluded that in this study in patients with type 2 diabetes and cardiovascular disease or renal disease plus another cardiovascular risk factor, efpeglenatide lowered the risk of serious cardiovascular or renal outcomes. Full trial results are available at nejm.org.